Good morning. We have been covering the shortage of nurses and long-term care spots in Canada for months now. It's been an ongoing problem. Well, this morning, we can tell you that shortage is reaching a critical level in New Brunswick. A hospital in the northern community of Campbellton is now at full capacity. That means they're actually turning people away from emergency care. The hospital has 145 beds for urgent care. Nearly half of those are being used for patients who do not need emergency help. Many of those patients are waiting for long-term care. Another 42 stretchers are being used as alternate beds. The hospital says the crisis could continue for days. So let's begin with John Northcott to lead off our coverage. We'll look at this, John, if you will, in microcosm, and then look at the national picture. But if someone is watching us this morning thinking about where they are in New Brunswick, if you go to the hospital in Campbellton, what's going to happen?
Well, if you are in an emergency scenario, presumably you will be given some assistance there. That's what they're in the business of doing. But if it's anything to do with obstetrics, surgical, or ongoing outpatient services, you will have to go an hour away to Bathurst to be treated there. This is a situation that has been building in the province. The province has committed to hiring 130 new nurses a year over 10 years. But in this particular case, with those 42 stretchers in the hallways, with the half of the beds, there's some discrepancy whether it's 140 or 165 beds. Nonetheless, 70 of them are being used by ACL patients. Now, those are alternative, ALC rather, alternative level of care. Now, those are people who are unable to care for themselves and yet are not in a critical medical scenario. Effectively, what we're talking about here are the elderly, what they refer to as the gray tsunami, people who are waiting for long-term care beds. And it's worth noting that in the province, the number of elderly waiting for long-term care is expected to double in coming years. The health minister is saying about this latest situation in Campbellton, it is simply a capacity issue. It is, he compares it to a hotel with a no vacancy sign out. That's effectively what they are putting on that hospital, at least for a week. They're going to continue to monitor it daily, but this is a situation that has been building for some time and is no easy solution.
As I was suggesting, this is not just a Campbellton problem. This is a national issue. What is the national picture?
It's enormous in terms of the number of elderly that are expected to need this sort of treatment in the coming years. Ontario, for example, needs some 40,000 long-term care beds, committing to 15,000, so really only a fraction of the total. The Conference Board of Canada just 2 years ago brought out a report that is edifying in what it has to say. 199,000 long-term beds will be required in the coming years. That up to 2035 will require $194 billion in additional spending, and the expected number of people that you'll need to hire for all of this. This is 123,000 people per year hired necessarily across this country to deal with long-term health care issues of Canadians. Now, the aspect to this, if there is good news in all this, the Conference Board of Canada is saying that if governments act, if governments make this investment, it will in fact have an enormous net effect on the economy, not only in contributing money, but also in contributing those jobs that are necessary. So it is a clear case there. It's a problem. It's only going to grow. These are lives at stake here. These are families worried about their loved ones. A situation, though, that if the investment goes in, the numbers show we could end up with a much better situation.
Okay, well, that would be the hope, I suppose. We'll check in with the hospital in Campbellton, I know, today for any updated information there. Thank you, John Northcott.